One of your New Year's resolutions may be to get your eyes checked. We've been talking about that a little bit. Let's go over to Cornell for more on that.
Okay, Jennifer, thanks guys very much. Of course, it is the new year, and it is a good time to get your eyes checked. And regular eye checkups is one thing that Dr. Brent Reed of Griffin Eyecare knows all about. Dr. Reed, thanks very much. Happy New Year to you.
Thank you, Cornell.
A lot of people, like I was telling the guys from the Lions Club, a lot of people maybe neglect the fact that their eyes, something might be wrong, and they don't get their eyes checked, and they should. Tell me about that.
People have the misconception. They think that regular eye checkups are only really necessary for people that wear glasses or contact lenses. And one of the problems that we get into is there are certain eye diseases that have no symptoms. Patients are unaware that they have any problems. Things like glaucoma, there are sometimes moles in the back of the eye, just like there are on your skin, but you can't see them from the outside. There's a number of other things which are easily treated and watched and prevented from becoming more of a problem if people are checked early. Mm-hmm. One of the sad things is oftentimes now with laser vision correction, we'll see people come in for their first eye exam in their mid to late 40s, never having been checked before, and we'll find things that unfortunately have already caused them some damage that they are unaware of.
Okay, we also have some photos of some severe eye disorders or not so severe eye disorders.
This is actually this is something called a pingueculus. It's caused by ultraviolet exposure. People often think these little yellow white bumps on the white part of their eye are cataracts. They're really not. Mm-hmm. They can be avoided by wearing good ultraviolet protection when they're younger. That's one of the things. This is a little more exaggerated example of something called a pterygium, which actually grows over onto the clear cornea if it moves in closer to the pupil. Those need to be excised because they can cause visual loss and damage.
Could that be mistaken for just a bloodshot eye or something like that to someone who may not know what it was?
It sure could, and oftentimes it can cause visual problems and disabilities as time goes by if it's left unchecked or untreated.
Mm-hmm. What about for kids too? Or tell me what this is.
This is actually a picture of a mole in the back of someone's eye that they were unaware they had. And this actually looks very much like it's developing into more than a mole, perhaps even a melanoma. And that happens on occasion. And this is someone with diabetic eye disease or a smaller mole actually, and you can see the tiny greenish brown spot, excuse me. And that's a small mole. That one caught early was easily watched.
What would be a symptom of that?
They wouldn't have any symptoms until it was actually large enough to cause visual distortion in the things you were looking at.
But could be caught with an eye exam?
Absolutely, caught early and treated very appropriately.
A lot of people out there who may need eyeglasses and don't know they need eyeglasses until they come and see someone like you for an eye exam, right?
There are a few of those out there, although most people recognize the fact they can't see to pass the DMV eye test. Mm-hmm. That's probably our greatest screening test in our society, is if you want to get a driver's license, you have to see to drive.
Some typical things that may bounce out at you at a routine eye exam. Are there some things that you should check for that?
Well, you should always have your eyes looked at carefully enough to have someone look in the back of your eyes. One of the things that people don't realize is the back of your eye, your retina, is actually part of your brain. And when we look in there, we can tell a lot about your neurologic and your vascular health by looking at those vessels and that nerve tissue, which is actually part of your brain. So we can tell a lot about certain systemic diseases and or the possibility of problems and head those off in advance.
Right, and I think we have some more
This is a picture of some lattice degeneration, which is actually a peripheral retinal problem that can lead to a retinal detachment. Needs to be watched, make sure that that doesn't progress. Mm-hmm. And we see that in about 1 in 10 people. This is another similar picture of lattice degeneration in a different light. You can see it crossing a blood vessel there. So these are some of the things that we can check for and make sure that it doesn't advance into something more serious.
Doctor, thank you so much for coming in.
Thank you, Cornell.
Happy New Year.
You too.